Hi, I'm Dr. Jan, owner of Chrysalis Chiropractic in Mankaot, Minnesota, here helping you transform your life. Today we're going to talk about the alignment of the cervical spine and the skull. Your skull on average weighs 10 to 12 pounds as long as it's in the proper alignment. But if your skull is farther forward than it should be, it can actually feel to your body as if it weighs 30 to 40 pounds. So if we were looking from the side and your head was farther forward, it would be like carrying something that weighs 10 to 12 pounds, and instead of carrying it close to your body, you're carrying it out farther. So if we look at the angle, if you were carrying a tray or something heavy up like this, you would want it sitting straight on your arm. You wouldn't want your arm to be farther forward or backward. You want it sitting at a very straight angle. And that's what we want in the spine too, in the neck. So here is a model of the spine. From the front, it should be completely straight, and unfortunately this might not be completely straight just because it's a plastic model. But we want, again, to be completely straight in line from top to bottom. But when you look at the angle from the side, so if we go like this, looking at it from the side, there should be a curve. And that would be the front of the body. This would be the back of the body. So there needs to be a curve going this way, and then another curve going this way, and another one going that way. And the reason that those curves are there is for cushioning. Because when we're moving, we need to be able to have a little bit of bounce in our step, so to speak. So those angles allow your body to have a little bit of cushion and give as you're moving and walking around. So this tool here was used many, many years ago by chiropractors to detect if there's a proper angle in the spine. So it has little springs on it that pull it together. So if you think of it in terms of this being our spine, again, in the low back, we want a curve that goes this way. And then in the middle of the back, we want a curve that goes this way. And then in your neck, again, you want a curve that goes this way. So that just like the springs here, it allows some spring as you're moving. Now, when the spine is in proper alignment, you will see that the gaps in between, if these represent the vertebrae, the gaps in between are nice and even. That's where your disc spacing is. If the angle is not correct, you'll notice that the disc then would be squeezed together here and most likely pushed out. Or the reverse, if the angle is not big enough, then the disc would be pushed back that way. So ideally, we want nice, even spacing between the vertebrae. So if you see someone who has a curve in their low back where it's at a very sharp angle, that is not a healthy angle, nor if it is flattened out, is that a very healthy angle as well. So we want a nice proper curve in our spine in order for us to have that cushion that we need. So if your posture is not in this ideal place like we've discussed here, then the next thing that you could do is stand and see that if you straighten out, how does that feel to you? Is it something that you're just doing because you're bored, or you've just come into the habit of standing or sitting like that? So bring your shoulders and head back to where they are in alignment and see if that feels right. And if it doesn't, then you may want to consider getting checked by a professional.